Can an old vaccine called BCG stop the new coronavirus? A tuberculosis vaccine invented a century ago is cheap and safe, and seems to bolster the body's immune system. Dr. Denise Faustman, Director of Immunobiology at Massachusetts General Hospital in Boston, has been studying a tuberculosis vaccine, known by its acronym, BCG, and its effect on type 1 diabetes for many years. A vaccine that was developed 100 years ago to fight the tuberculosis scourge in Europe is now being tested against the coronavirus by scientists eager to find a quick way to protect healthcare workers, among others. The Bacillus Calmette-Guerin vaccine is still widely used in the developing world, where scientists have found that it does more than prevent TB. The vaccine prevents infant deaths from a variety of causes, and sharply reduces the incidence of respiratory infections. The vaccine seems to train the immune system to recognize and respond to a variety of infections, including viruses, bacteria, and parasites, experts say. There is little evidence yet that the vaccine will blunt infection with the coronavirus, but a series of clinical trials may answer the question in just months. On Monday, scientists in Melbourne, Australia, started administering the BCG vaccine or a placebo to thousands of physicians, nurses, respiratory therapists and other healthcare workers, the first of several randomized controlled trials intended to test the vaccine's effectiveness against the coronavirus. Nobody is saying this is a panacea, said Nigel Curtis, an infectious diseases researcher at the University of Melbourne and Murdoch Children's Research Institute, who planned the trial. What we want to do is reduce the time an infected healthcare worker is unwell, so they recover and can come back to work faster. A clinical trial of 1,000 healthcare workers began 10 days ago in the Netherlands, said Dr. Mihai Ginita, an infectious disease specialist at Radboud University Medical Center in Nijmegen. 800 healthcare workers have already signed up. As in Australia, half of the participants will receive a placebo. Dr. Denise Faustman, Director of Immunobiology at Massachusetts General Hospital, is seeking funding to start a clinical trial of the vaccine in healthcare workers in Boston as well. Preliminary results could be available in as little as 4 months. We have really strong data from clinical trials with humans, not mice, that this vaccine protects you from viral and parasitic infections, said Dr. Faustman. I'd like to start today. The BCG vaccine has an unusual history. It was inspired in the 1800s by the observation that milkmaids did not develop tuberculosis. The vaccine is named after its inventors, Dr. Albert Calmette and Dr. Camille Guerin, who developed it in the early 1900s from Mycobacterium bovis, a form of tuberculosis that infects cattle. The scientists cultured bacterial scrapings from cow udders, and continued to culture bovine TB for over a decade until it was weak enough that it no longer caused virulent disease when given to lab animals. The vaccine was first used in humans in 1921 and was widely adopted after World War II. Now BCG is primarily used in the developing world and in countries where TB is still prevalent, where it is given to over 100 million babies a year. Like other vaccines, BCG has a specific target, TB. But evidence accumulating over the past decade suggests the vaccine also has so-called off-target effects, reducing viral illnesses, respiratory infections, and sepsis, and appears to bolster the body's immune system. The idea is an offshoot of the hygiene hypothesis, which suggests that the modern emphasis on cleanliness has deprived children of exposure to germs. The lack of training has resulted in weakened immune systems, less able to resist disease. One of the earliest studies hinting at the broad benefits of BCG vaccination was a randomized trial of 2,320 babies in Guinea-Bissau in West Africa, published in 2011, that reported that death rates among low birth weight babies were dramatically reduced after vaccination. A follow-up trial reported that infectious disease mortality rates in low birth weight babies who were vaccinated were cut by more than 40%. Other epidemiological studies, including a 25-year study of over 150,000 children in 33 countries, have reported a 40% lower risk of acute lower respiratory tract infections in children who received a BCG vaccine. A study in the elderly found that consecutive BCG vaccinations reduced the incidence of acute upper respiratory tract infections. A recent review by the World Health Organization concluded that BCG had beneficial off-target effects, and recommended doing more trials of the vaccine against a wider range of infections. "This vaccine has saved as many lives as the polio vaccine. It's an amazing story," said Dr. Curtis, who designed and launched the BCG trial in Melbourne in less than a month, hoping to stay one step ahead of the coronavirus's spread in Australia. While he described the BCG vaccine as underappreciated, he emphasized that it was not a specific COVID-19 vaccine. BCG also cannot be administered to anyone who has a compromised immune system, because it is a live-attenuated vaccine, meaning it contains live but weakened TB. Dr. Faustman said it should not be used in hospitalized patients with active disease, because it may not work fast enough and could interact poorly with other treatments. A recent analysis of the disparate toll the new coronavirus has taken on middle and high-income countries found a correlation with BCG policies, concluding that countries that did not implement or had abandoned universal BCG vaccination have had more coronavirus infections per capita and higher death rates. Low-income countries were excluded from the analysis because of unreliable COVID-19 reporting data and generally poor medical systems. "You can make a new vaccine," Dr. Faustman said. "We're really smart, and we can do that. But it's 2 years off, and 2 years is going to be 2 years too late. If we've got something generic globally at hand that we can use to make the human host stronger, this is a win-win for the public right away."